Hello, I'm Rachael from the Oncology Network. Welcome to the Oncology Podcast's Experts on Point series. Are you talking to your patients about sex enough? Research suggests that most healthcare professionals aren't having these conversations as often as they should. To shed light on this critical topic, I'm joined by Associate Professor Safeera Hussainy. Safeera is the Senior Pharmacy Research Manager at the Peter MacCallum Cancer Centre in Melbourne, Australia. So, let's dive in and talk about sex and cancer care. Hi Safeera, welcome to the Oncology Podcast's Experts on Point series.
Thank you so much, Rachael, for having me.
Oh, it's a pleasure. Now, I like to start by getting to know our guests a bit better. Can you tell us something surprising about yourself?
I'm not sure. I'm quite boring and regimented now. However, might be interesting to know that I would have liked to have done health journalism. I wanted to do journalism when I was thinking of what I should do, but I ended up landing in pharmacy.
Oh, wow. I mean, quite different.
They are. I was attracted to journalism because I loved writing, and I still do. And I enjoy speaking, public speaking. And actually, in my pharmacy role, I've had a chance to do both through conference presentations and interviews like this and writing. So I've been able to engage in those mediums, but I don't think I'm famous yet.
Oh, well, this will definitely help with that. So I'll move on to what we're here to discuss today, which is sexual health and well-being for cancer patients. So just to set the scene, can you tell us what are the common challenges patients face regarding their sexual health after a cancer diagnosis?
Yep, thanks, Rachael. In terms of the challenges, the cancer treatments have an impact on people physiologically, and the types of things that play out include erectile dysfunction, libido, vaginal dryness, body image issues, and so on and so forth. So quite significant issues.
And how do anti-cancer therapies typically affect sexual function and intimacy for patients?
Sure. So the anti-cancer, anti-tumour therapies can disrupt the neurovascular network in the genital areas and normal gonadal hormonal regulation while impairing body parts and reproductive organs. And this then results in a range of biological side effects, including those that I've mentioned, and that can then trigger negative emotional symptoms. So the other symptoms from cancer treatments, such as fatigue, which is number one, nausea, vomiting, and psychological distress upon cancer diagnosis, that can lead to depression and anxiety, can also affect sexuality. Finally, body image concerns from surgery and radio or chemotherapy, such as hair loss and weight gain, can also impact patients' confidence with the fear of being unattractive or inferior in sexual performance. And that then leads to a declined self-esteem, social withdrawal, reduced intimacy, and relationship conflict.
Thank you. It's a long list, isn't it?
It's massive.
Now, are there specific types of cancer or indeed specific types of treatment that tend to have a more significant impact on sexual health?
There's nothing documented in the literature to indicate that there are specific types of treatments that cause one symptom over the other, and it does vary across the board depending on the type of cancer that you have. However, the literature also cites that this does impact mostly everyone who's got a diagnosed cancer and is undergoing treatments, anywhere from 40 to 100%.
It's quite sobering, isn't it?
It is.
And what are the sort of common misconceptions or taboos surrounding sex and cancer that you encounter?
Well, the word itself, sex, is something that everyone hesitates to talk about, and it is seen as taboo. A lot of people also think that it's not their problem to raise it. It's not their job. It's not within their scope of practice. However, consumers who we've spoken to in the work that I'm leading have mentioned that it should be everyone's responsibility. Every clinical domain needs to raise this topic across all points in the cancer care continuum. And so elaborating on that, some of the barriers from the patient side are lack of access and resources to information that's targeted to them. So there are resources out there, but they're not specific enough or directed enough. Fear of stigma and causing discomfort to health professionals if they raise the topic, and also lack of prioritization. So other symptoms such as fatigue and nausea and vomiting tend to take precedence over sexuality, which comes up as a piece later on in their journey once things have settled a little bit. And then in terms of health provider barriers, lack of confidence and knowledge in how to raise this topic, how to talk about it respectfully, what sort of terms and language to use. Similarly to patients, fear of causing discomfort to them and their partners, and then lack of time and prioritization.
I think it's interesting that you noted the preference for people across the entire sort of treatment team, the entire MDT, to discuss this, to bring this up. So I wonder what the role of the pharmacist is when it comes to communicating with patients about sexual health.
Again, there's not too much out there in the literature in terms of exemplar models, clinic models that we can look to see the different roles of health professionals and in particular the pharmacist role. But if we look at the pharmacist role in other areas specific to cancer care, for example, in delivering pharmacogenomics, for example, in leading other interventions, and not just in cancer care, but also in the primary care setting, for example, in providing recommendations for chronic disease management, then we know that pharmacists are experts in medication and in providing advice around using medications. So therefore, if we extend that and extrapolate that evidence, we could say that pharmacists do have a role to play in this area, and the opportune time would be when dispensing and providing medications to patients and counselling on them. And it might just be, having anchor or a hook to bring up the topic. So, for example, has anyone spoken to you yet about some of the side effects that this can have on sexual health or on sexuality? And that would be a good leeway into having a discussion if the patient was willing. The other consideration for pharmacists is the environment, and that can impact the quality of the interaction. So making sure that there is privacy if available. And in our setting where I work, we do have a consultation room. And in a lot of pharmacies, there are consultation rooms. So there could be an invitation extended to the patient and their partner or carer if they were willing to engage in that at that time.
Yeah, it's a really good point. Patients with cancer need to feel comfortable about discussing these issues. And we've all had certain experiences sometimes where you're going into the pharmacy and you've got something slightly embarrassing that you want to discuss, and there's a very long queue, and you can feel really awkward even around really small things.
Of course, it's a very open environment.
Yeah.
And I think it's really important for pharmacists and other health professionals to just normalise it, to say, look, this is quite common, or, in my experience, I've found other patients have gone through this. Is this something that concerns you too?
Mm-hmm. And those open-ended questions can help you to then establish a rapport.
Absolutely. Back to 101 in communication.
Yeah, exactly. So beyond the treatment side effects, we touched on this briefly, but I'm wondering if you can discuss in more detail the role of mental health and emotional well-being when it comes to sexual recovery after a cancer diagnosis and treatment.
Yeah, so I think that the impact on psychosocial health is not spoken enough and not documented enough in the literature, and it's massive. In speaking with patients, that's the number one thing that they talk about. And if I can quote some of the comments from some of the lovely consumers who I have had the chance to spend some time with and speak to, they've said things like quality of sex life equals quality of life, or sexual health is living too. And this zero libido plays out in my life every day. It impacts on my relationship so greatly that it is taxing. We need to be talking about this honestly. One of the really cool tips that I heard from one of the consumers was that instead of saying you'll be experiencing a new normal to patients, it's better to focus on how can you make that a better normal for them. Because saying you'll be going through a new normal without providing any backup advice or strategies on how to deal with that new normal is just as bad as not saying anything. And so in facilitating that, there is a really nice book series, and it's available as an ebook as well. And there's also a YouTube channel by Tess DeVez, who is an OT and also has lived experience of cancer, on how to live a better normal with cancer.
Oh, thank you. We'll make sure that we include links to that in the show notes. That's a useful resource.
Thank you.
Thank you.
And then finally, this is from someone who is both a health professional and a consumer who's had lived experience of cancer. When the physical sexual side effects go unaddressed, the psychological impacts are severe.
It's very illuminating. Thank you for sharing that. So, do you think oncology healthcare professionals talk about sex enough?
No, not enough. From all the evidence I've examined and all the health professionals and the consumers I've spoken to, they don't raise this enough. They don't give it enough priority due to those barriers that we discussed before. And it should be placed up front in that discussion. We've got the screening tools and the questionnaires available to have these discussions, to facilitate and assist. We also have resources like question prompt lists and checklists for patients to bring into consultations. It's just about the health professional leading the discussion, because I think it would be quite hard for patients to bring it up on their own.
Yes, absolutely. And as you've alluded to with your research, patients say this is their number one priority. And so healthcare professionals are letting their patients down if they don't step up to having this conversation.
Yeah, I agree with that statement. Health professionals come in with a set of expectations and being able to gather information from patients, and likewise patients and their families and their partners come in also expecting from health professionals. And this may not be on a patient's radar initially because they're dealing with so much, especially when they get a cancer diagnosis. It's not that obvious, and they may not have read enough at that point to know that they should expect these sort of side effects. And if there's some hesitation in framing the discussion around particular side effects, just making a general statement around the fact that side effects can occur and asking the patient, have you read anything or have you heard anything? That could be another way to open up the topic.
And so I think this is an opportunity, as our audience is primarily healthcare professionals who are working in oncology or an interest in oncology, to give some really practical insights to help listeners improve their communication skills around this. So when it comes to delivering information about sexual health to their patients, what would your top tips be?
That's a really good question. I'm going to be guided by the communication frameworks that are out there. There are so many, and I'll just mention one because I think it's good if we can focus on one of them to guide us. So that's called the BETTER model by Althoff et al., and that was published in 2013. So the B stands for bringing up the topic of sexuality and sexual functioning. And I gave some example statements on how this could be raised. E, explain to the patient or their partner that sexuality is part of quality of life and it can be discussed. So you're giving them permission to have that discussion. The T is telling the patient that resources will be provided and about the healthcare team's willingness and interest in addressing sexual concerns. And so you should have, or the team should have, a set of resources ready to go, ready to refer the patient onto. The second T is timing the discussion for when the patient wants to raise the topic, emphasising that they can raise it at any time in their journey. E is educating them about possible or expected changes or sexual side effects of treatment, and then available interventions for treatment and for the symptoms that might emerge. And that's a really important point because in a recent audit that we completed in my workplace of sexual health assessment, diagnosis and referral for a sample of patients with breast cancer, we found that, first of all, documentation was poor, and that doesn't mean that the discussions aren't taking place. We're just going by the documented evidence. But then when there were issues, and there were for a significant number of patients, interventions were not recommended so readily. And these are mainly non-pharmacological interventions. And there are pharmacological interventions too. So having an awareness about what those are and recommending them up front is also quite wise. And then the R in the better model is to record everything. So record it in their notes that these discussions have occurred so that anyone else in the treating team can have a look at those notes and know where things are at and then follow up as well. And finally, part of that recording is also referral. So referring patients to specialist services where necessary, so such as gynecology or a menopause symptoms after clinic or psychology and psychiatry.
Thank you. Now, could you talk us through what some of the common management strategies are?
Sure. So if we talk about the management strategies according to the type of symptoms patients are experiencing, that would be the easiest way to tackle it. So for someone who's experiencing erectile dysfunction, the PDE5I or phosphodiesterase 5 inhibitors are a good management strategy. Alternatives include a vacuum erectile device or a medicated urethral system for erection. Also for vasomotor symptomatic relief, medications like venlafaxine, medroxyprogesterone acetate, cyproterone acetate or gabapentin can be used. There are some lifestyle modification strategies that can also be implemented and individual or couple-based psychosocial interventions. For menopausal and vaginal symptoms, you could offer HRT, hormone replacement therapy, and alternatives for vasomotor symptomatic relief include paroxetine, venlafaxine, gabapentin, and clonidine. The literature also speaks a lot about physical or pelvic floor exercises for people who are going through menopausal and vaginal symptoms to strengthen the area. Also vaginal estrogen or vaginal dilators and lubricants. So there are different types of lubricants. There's water, oil, or silicone-based vaginal lubricants that can be used with sexual activity and vaginal moisturizers for daily comfort. There's a saying that I learned from Tess DeVez, who's written a good series of resources on this topic called The Better Normal. This is what she said: if sex is toast, then lube is the spread. So I won't forget that one.
Yeah, it's a good one to remember.
Just tells you how important lubricants are in improving the quality of sexual interaction and quality of life for patients. Finally, for menopausal and vaginal symptoms, there's sexual aids such as vibrators or clitoral vacuum devices. And then the last category is body image or relationship and sexual satisfaction concerns. The evidence points to using psychotherapy to talk through these concerns and also couples-based counselling.
Excellent. Well, thank you. In an ideal world, what would your best practice be when it comes to that supportive aftercare?
Yeah, in an ideal world, I would love to see everybody talking about sex and sexuality in cancer and raising it in every discussion that they have with the patient and their family, and talking about it as if, they're talking about the other symptoms. And what comes with that is being able to use really effective communication techniques such as teach back, motivational interviewing, open-ended questions, like you mentioned, those sorts of things that people are already very well versed in.
Yes, the professionals have the skills, but they're not necessarily applying it to this problem.
Correct.
Because we know that lots of clinicians are often asking their patients about beyond their symptoms, about their diet, about their lifestyle, whether they're maintaining a social life. And so their sexual life is as important, if not more important, as you've mentioned.
That's right. It's something that shouldn't be kept behind the closet or the curtain. We need to unveil that curtain and bring the problem onto stage, as they say, and talk about it.
Yeah. So what's next? What's your next sort of work in this area?
So we've just finished this audit I mentioned, and we're analysing the data from that. We've also wrapped up a scoping review of questionnaires, screening tools, guidelines, education programs, and service delivery initiatives, all of those particular to adolescents and young adults. And that publication will be available hopefully soon. And the next step, which is really exciting, is that we're going to be co-designing a sexuality clinic at my workplace.
Oh, that's excellent news. Well, congratulations. That's exciting.
Thank you. So we're going to be working with consumers and health professionals to work out what needs to happen, what does it need to look like, who needs to be in the team, what needs to be the FTE of the team, what are their roles, and then developing a business case from there.
And will you be treating across the board or just AYA? Or
the intention is for it to be available to all patients with cancer and not to be specifically targeted to one particular group. However, when we're scoping the model and we're doing those co-design workshops, it'll be interesting to see what comes out if participants do think that we need to focus on particular groups, or we can offer such a service as a one-stop shop.
Okay, well, please keep us posted because that sounds like a really exciting intervention.
Absolutely.
And really to help shine the light, as you say, on something that we all need to be talking about a lot more.
Yeah.
Thank you for coming on the show. I've really appreciated you taking the time to talk us through this because, as you say, you know, the statistics and the feedback that you have from consumers is really startling and sobering. You know, some of these fixes, simply asking an open-ended question, are quite easy and something that people can incorporate into their practice straight away. So hopefully this helps you with that mission to get everybody talking about sex.
Thank you so much, Rachael, for having me. I had a great time. And I do also hope that this just primes people and lifts the lid on the topic and gets them thinking about it.
Fantastic. Thank you.
Thanks. Thanks so much.
You've been listening to the Oncology Podcast's Experts on Point series, brought to you by the Oncology Network. To explore more podcast episodes, head over to our oncology portal at oncologynetwork.com.au. Registration is free for healthcare professionals and provides access to exclusive content and educational podcasts. If you found today's episode valuable, please share it with your colleagues. And if you have exciting research or news to share with our listeners, we'd love to hear from you. This is Rachael Bavin. Thank you for tuning in to the Oncology Podcast.